Good morning. My name is Dr. Robert Pass, and I'm the Chief of Pediatric Cardiology here at Mount Sinai Medical Center on the Upper East Side of Manhattan. I'm making this brief video today to ensure and make sure that everybody who's our patient knows that our practice is safe and it's safe to come to the doctor at Mount Sinai. And so what I thought I would do today is show you what it'll be like when you come to the hospital to see one of the providers in our pediatric cardiac program. So why don't you come with me, we'll take the trip in and you'll see exactly what it's going to be like when you come to Mount Sinai. Hello. We're now inside the main lobby of the hospital, and now we're going to take a little walk up to pediatric cardiology. I want to show you how it's going to be the day you come to visit us in this new post-COVID world. So I'm walking now into the Annenberg building. Right now we're in the Guggenheim Pavilion. This is a very large space right near our building where pediatric cardiology is. Let's take a quick look at what it looks like. As you can see, you can even get a cup of coffee. This is the Annenberg building where we're going to go see pediatric cardiology. So come on along. Now there are multiple sets of elevators. I want to remind everybody we're going through the B2 to 8 elevators because we're on the 3rd floor of Annenberg. Okay, here we are about to get into the elevator to go on up to pediatric cardiology. Remember, the 3rd floor. As you can see, the elevators are fairly empty because we're trying to schedule patients with a lot of time between them. Very easy to socially isolate yourself and distance yourself from others. Come on, let's go up to the 3rd floor to see cardiology. I've just gotten out of the elevator on the 3rd floor. As you can see, we have signage here to tell you exactly where to go. And importantly, hand sanitizer right near the elevator bank. I think I'm going to use a little myself. Let's go on into cardiology. Okay, so now I'm walking down the hallway towards pediatric cardiology to the Children's Heart Center. Why don't you come with me? I'll show you what it's going to be like. When you get to the Children's Heart Center, the first person you're going to meet is Wally. Hi. Wally's one of our medical assistants, and every single patient who comes to the Children's Heart Center, before they even walk through the door of our center, has a temperature taken, and there's a brief intake to make sure everybody is healthy and well before they come in. They're given a mask, as well as the parent a mask, and then they're escorted into a patient room. There is no such thing as a waiting room here any longer because we want all our patients to be isolated from one another. At this point, Norma, who's one of our medical assistants, would take us into a room, and so I'm just going to show you how that basically is going to look. So Norma would usually bring me. Okay, so now Norma's going to escort me and your family to the patient room. As you can see, we're going straight to the exam room, which is somewhat different than usual. Here we are. Norma's going to show me into exam room 2. Why don't you come on with me? Once we're here, Norma will take my vital signs, take some basic information, and then when she's finished, she's going to let the doctor know that the patient is ready, where everything will be done. And the goal is to try and keep everything in this room so that you're not walking throughout the heart center. It's actually very safe here. Every single room is sanitized between patients. We have hand sanitizer everywhere, soap and water everywhere, but just for extra carefulness, nobody is going to be walking through the hallways as a patient unless it's absolutely critically necessary. So when you're done with your visit, you'll be done, and you'll just walk straight from here with a mask on, out of the building, not having to interact with people. Even interacting with the front desk staff will no longer happen. The front desk staff is coming to you. So your sign-in, all of your insurance information will all be taken here. Nobody is waiting in the waiting room. At the present time, and hopefully in the future it'll change, but for right now, there is no such thing as a waiting room. Nobody waits. You come in and everything is done in the same place, all to ensure safety for our patients. I hope you've enjoyed this video. And I hope that you'll come join us at the Children's Heart Center at Mount Sinai. We are committed to the good health of our patients. We have been for 30 to 40 years. We remain that way today. Please come join us. We want to help take care of your children's heart health.